Okay, what happens if a supervisor has approved the question, another reviewer finds bad? Yeah, that's what we are trying to reduce the incidence of by this workshop, because sometimes that happens where a supervisor would say that a question is okay, and then when the proposal goes out, then the reviewer kind of like flags all that. So I think it's good for us to interact over it. I would say one thing that would help this from happening is if in our departments we even have things like seminars where the residents present their research questions, different people critique them, and we come to some agreement about what are the good questions. Then before they get down working on their proposal, because sometimes if the resident is working with only one person, I mean, many eyes looking at the thing would kind of like help. I mean, it may sound okay to you, and the resident works on it only for it to be flagged by somebody later. So we are hoping that these discussions we are having and this material that's made available will reduce the incidence of that happening. Sandra, do you want to address this? The question is, are the research questions and the study objectives supposed to end up looking around the same?
Okay, yeah. So one thing I always keep saying is, usually there's no section in either the proposal or the dissertation where you have research questions. But the research questions are supposed to hone into your objectives, because basically the questions you're going to be answering will end up answering the question. So that sort of sets up the tone for your objectives. So definitely it does. Thank you. So how much time will you allow residents to develop a research question? Where that's a difficult one, but I always keep on saying I would rather invest a lot of time in defining that research question and getting it right than to go all the way and then having problems along the way. Because like I said, the research questions become your map or your guideline for which the study is going to be done. So if it takes, for me, so long as it takes, no matter how long it takes to do it and do it right, maybe the yardstick. However, like I said, it should be within the limitations of Ghana College, because you know that there are timelines that the resident has to finish. So maybe one thing we can do is let's encourage them, once they come in, initially they start their fellowship, let's start asking them, what questions are you, or what topics are you interested in? And that starts that conversation with, can you give me 1, 2, 3 questions you want answered? And that will set them thinking, because a lot of the times they don't really know exactly what they really want or how they want to do it. But setting them on that path to look for the questions usually guides them. And I think maybe a month should be a good time to get a good research question done. Thank you. Please, is it a must to have 3 research questions? In most instances, the questions are similar and not necessarily addressing any question. So it all depends. I just use 3 as a guide. It's not a must. What is best to do is set them to ask a question that hones. Sometimes you can ask a question that hones and subdivides them into the objectives. So for example, we asking what is the effect of insulin on mortality amongst diabetic patients. That question is, does insulin reduce mortality amongst diabetics? Maybe that would be your broad question. And based on that, you can figure out your objective and then your specific objectives from there. So, and you also don't want to ask so many questions. So as much as possible, it would be good to have just one great question, but sometimes it may be good to have a little sub-ones. For example, maybe you want to look out for the prevalence of periodontal disease amongst Ghanaians, and then you want to look out for the risk factors of it. Your first question is, what is the proportion of Ghanaians in Accra who have periodontal disease? That's one great question. But then you also want to look out the risk factors. So what are the associated factors of that predispose somebody to periodontal disease? So for such a study, you may have 2 questions. But as much to be practical, I don't think we want to do anything beyond 3 questions. That would be too much. As much as possible, the best thing would be to focus on 1. But depending on what research, you may just do 1 or 2.
And maybe what I'll add to that about the question is that there are these things that people say about questions that for a comprehensive question, there are some 4 elements that you want to be there. And Sandra showed that in all the things that she showed. What's the target population? Is there an intervention that you're studying? Are you comparing any 2 groups? And then what's the outcome of interest with it? That's the PICO that they talk about for questions. So usually you can have one question that's a comprehensive question. I mean, does insulin reduce mortality amongst diabetics? Then out of that, you can get sub-questions that then work out as the study objectives. So that's what it should be, rather than listing multiple what do you call it, questions. Now there's a comment here about I assume the college runs all final dissertation reports through the Turnitin system. Is there a way the residents can take advantage of the Turnitin system prior to the official submission of final dissertation? The thing is that it's the residents themselves who run their dissertations through the Turnitin, and they get the similarity report and then get that to their supervisors. And if it's more than 25%, they revise that before they bring the dissertation and submit finally. So it's not as if they submit the dissertation, then the college runs it through, then you get a message and say, I mean, this is the similarity report is too high and you can't do it. The residents have the chance to run through the Turnitin themselves. And I probably want to read this comment from.
I have borrowed the acronym FINA to determine how suitable a research question may be. Is it feasible? Is it interesting? So what? That's great. Is it novel? Is it something new? Is it ethical? Is it relevant? You have probably covered it all. But it's a beautiful acronym to summarize it beautifully. But then Conrad Buckle also makes a comment. He says, I came across a PICO research question generator at www.picotquestion.com, perhaps to assess and consider for use of journal clubs. Thanks so much, Dr. Buckle. That's great. And we can take it up. It's maybe a great website to generate questions and to also to guide them. It's a good starting point. Thank you, Dr. Buckle.
So please look in the chat box, the comment by Dr. Drew and Conrad. These are helpful resources. One thing that we can do, I sometimes do that when I'm in this webinar, is that you might not have the time to read through all the chat. So I just highlight the whole chat, copy it and paste it in a Word document before we get out of the meeting. And afterwards, I delete the ones that are saying things that I will not be useful, and then I keep things like the web addresses that are there. So you could do that and just copy out the link that's put there by Conrad, and other people shared other things earlier on. Yeah. Prof. Goka, please go ahead and speak.
Thank you for your presentations. I think in my department, we let our residents present what we call a zero draft of their proposal, and then they go and refine it further. But I think from today's discussion, we shouldn't wait till, because by then it means that they've really done a lot of work, and perhaps the research question might not have been that good. And so I think we can have a session where people are presenting their research topics and research questions, and then later they can present their zero draft of their proposal to us for refining before they bring it to the college. Sandra mentioned that I think people from different institutions that they've done masters or PhDs or whatever with, it has crept in that when people's dissertations are being marked or even at the proposal level, whoever assesses it, it didn't used to be so in the past, but quite often they'll say, we don't see your research question, we don't see your hypothesis, even though the candidate has got objectives. So my question is, what does the college want? Do you want, or do we want research questions written within the proposal, as well as objectives? And then, is the hypothesis always necessary? I mean, for some researchers, I think it's necessary, but it seems like there's a trend towards people want to see research questions, hypotheses, and objectives in the proposal and the final dissertation. So can you speak to that, please?
Right. Thanks, Prof. Goka. I mean, Prof. Goka is a very gentle person, so she talks about what she'll be doing in her department. I mean, some of us we don't have the gift of being gentle. So I would rephrase what Prof. Goka has said and say that all of us as supervisors going back now, we should get the residents to present their research topic and research questions. We work on that till we are happy with that before they move off to write the proposal, and not just tell them to go do a draft of the proposal and bring. So that is the Bamela law for the college that has been passed today. So let's stop asking the student, the residents to go and bring a draft of the proposal for us to look at. Let's spend time. I mean, Sandra said up to a month with them. Go back and forth, settle the research topic, settle the research questions, and the rest of the writing really would not run into problems. So that's what we should all be doing. Prof. Goka, I hope I've paraphrased your gentle statement in the legal sense. Now to the question that you asked, I think every research document should definitely have objectives. Every research document should have objectives spelled out. I mean, when you have the objectives spelled out, you sometimes don't need to write the research questions separately. So, but definitely there should always be objective, because the thing is that at the end, assessing your research is assessed by your objectives or your research questions. So there's really no need to have, let's say, necessarily the two. And like you rightly said, it's not every study that requires a hypothesis. So if the reviewer says, where is the hypothesis? I mean, there should be some reason why that hypothesis is not there, and that response can be made, even if it's at the exam level. The candidate should be able to explain why for this study there isn't a hypothesis that is being tested. Not every single study requires a hypothesis, but every study should have clearly stated objectives, because the objectives then serve as the marking scheme. At the end of the day, have these objectives been achieved, or have these research questions been answered? But I would say, if we are picking between research questions and objectives, let's have objectives. Or you can put both out there, but usually one tends to be a restatement of the other. Sandra, won't you say that? Okay. Yes, okay. Professor Manu, please unmute your mic and speak.
Right, thanks, Prof. Just to share a little experience from the 37 Military Hospital. We found with dealing with the residents that if we had to do research design very early on, it helps with the issue of research question, then the controversy of whether you need a hypothesis or you need a research question. So I'll say probably after we've done research design, we'll see whether a little introduction to research design very early in the proposal helps them appreciate how to put their research question and clears their mind on what to put in. And I can appreciate what Prof. Goka said. You see proposals now that you have, I mean, you have the question, you have the hypothesis, and I guess is because of lack of clarity in design. So maybe after design, we may all agree whether we'll be able to bring it forward. And it probably has helped our candidates who were struggling to understand their proposal and they're developing their research question. Thank you.
Thank you so much, Dr. Asmanu.
Province, please go ahead and.
Yes, thanks. I think my little probably clarification I want. I mean, sometimes this research hypothesis in the question, of course, other the alternate, you are bringing this or that. But sometimes it's the guidelines. When you are reviewing a proposal, you have the guidelines with you. And if it has been itemized that the person should write this, and then you have to question it. And so I think just trying to revise the guidelines, let us be very clear on that. That either you do this or that, or depends on what you are doing. Because sometimes when me I'm marking, always the what is written there is what I'm following. And so I think let us take note of that and probably clarify it in the revised guidelines that you want to do. Thanks.
Okay. And I guess what we probably need to put there, like you're saying, we should revise these guidelines and the marking schedule that we have. We probably should have a question for the assessor. Does the research question require hypothesis? And then if it's yes, then is the hypothesis appropriately stated? That's kind of thing. But however, having said that, I would go ahead and say that there are some quantitative research experts who believe and they defend it that every quantitative study can have a hypothesis, even the prevalence studies, where your hypothesis would be that the prevalence of, let's say, periodontal disease in the population is more than 60%. So then you kind of like use that to calculate your sample size. So there are some people who they swear by a hypothesis. So we should just keep that in mind. It depends on probably where they did their research training. There's a group I know that, I mean, unless it's a case report, there will be a hypothesis. So, but we know that not every single thing needs a hypothesis, and we'll be able to work with that. Yes.
Rector, can I say something?
Please go ahead. Please go ahead.
Yeah. So I think you nail it mostly, but let's also be wary and be aware that it's not everybody who can produce all the tick that all of us wish we could do. But in essence, I absolutely agree, especially vetting the trainers, in terms of the publications and all, because truthfully, if you engage them directly, and this is without me, I'm not sure we are publishing this, but if we are being truthful, is a trainer problem. Okay, so like our children we have in our homes, and whoever we have as dependents, they need the guidance from us. Okay, and so what they may have topics that they might have thought through privately, independently with other consultations, but certainly they will run it by you, and you have to take charge and say, this is right, this is not right, or what is it that I can tweak with your proposal, to make it right. And that's what we have been doing. And we encourage our residents, one, to push it forward early in terms of their thoughts, how they want to approach their fellowship training. Yes, the regular stuff are all aligned and planned before you join it. But in terms of dissertation, we are much involved. And we insist on making things right at beginning and also during training.
Okay.
Thank you.
Right. Thanks. There's a comment here which I'll take together with what Dr. York has said. I mean, there's a comment here that from Cole Entomensa that I've not seen the residency guidelines yet, but from the presentation, I get it that a resident must have an entry interview as soon as he or she is posted to a unit or department. Is it in the guidelines? How do you suggest this is organized? And from what Dr. York has said, what Dr. York is saying, I mean, linked to this, is that we as the supervisors have a responsibility. And if the residents appear to be struggling, it's because we are probably not meeting our responsibility. Dr. York, have I paraphrased you correctly?
I believe so, and you believe me, you mean we need to guide them, especially is a fellowship.
Yeah,
it's not a PhD, so there are deficiencies which we can talk about in another discussion. So,
okay. Right.
Let's guide them. Thank you. Over.
Good. So what he's saying is that we need to meet our responsibilities to guide them, and I wouldn't say that all the things that we need to do are spelled out in letter, point by point in the guidelines. No, but it's like generally from what we've said here, the need is that when a residency gets into the fellowship program, very early in that program, I would say within the person's first month, there must be a supervisor or supervisors that the person has, and there must be a meeting between the resident and the supervisors to go through these things that we've discussed today about research topic, research question, and all that. And it would be good, I mean, it is also needed at the unit or departmental level for there to be like a seminar, like what Prof. Buka was talking about, where all these residents come together and there is this discussion or a presentation similar to what we've just done here. And that's why we are making all this material available. We can, I mean, this is, what do you call it? Creative Commons license. We can use it and present to the residents so that they know these things. And then when they engage the supervisors one-on-one, the discussion is around this. And what we are seeing now is that the first thing that we should be doing is to make sure that they pick an appropriate research topic and pick research questions that can be worked on. And that are like Dr. Drew put up, using that final acronym. And that then makes the writing process easier. Actually, if we spend a long time having this discussion with them and sort of research questions, that would be there. So it's not that they must have an entry interview, but we must have a system, like Dr. York was saying, where we actually engage these residents, have these discussions with them, and get to the point where the whole unit gives an okay for the research questions before they go start writing the proposal. And you don't have any business beginning to do the writing of the proposal if the research topic and research questions have not been approved. As for the title, you can come up with a title at the end. After you've done the whole thing, you can craft the title, but it's the questions and the topic that we need to get going. Right.
Thank you. And Dr. York, just whilst I agree with everything you said, and especially one Prof. Adaduna said, I just want to sound a little word of question. Sure. Sometimes talking to these residents, they're like, my supervisor said I should do this, or they changed the topic and they did this and they did that. Sometimes they get frustrated along the way, and they attribute it to the fact that their topic or their question was sort of changed by their supervisor. So I believe in dialogue, and I believe in the students owning the research. Let it be, you see, when you're carrying out research, you love it when you're passionate about it. So whilst agreeing with you, I would say we should make our role be more of guidance and shaping, and be cautious about maybe imposing. Let them own it. That way, when they hit the wall, they come back to you for you to guide them, and it's not as if you changed it or you ask them to do something. Then it's easier for them to accept.
Perfect.
Thank you.
Oh, perfect. I will even wait for it to end. It's perfect. I mean, you should get them involved. absolutely every step of the way, Yes, and but let me just quickly reiterate what I just said. And once they enter into postgraduate training, there must be an interest from somewhere, either immediate supervisor or the departmental level. And once we are clear where the directions are, then we engage them into exactly what they want to do for fellowship. And we are solidly behind them to achieve as it is what they want to do. And from medicine, representing the head and everybody else, we are keen. And for endocrinology, it's even more stringent. And we'll guide you. We will let you do what has to be done. So thank you.
Thank you very much.
Mrs. Hewlett. Yeah, sure.
So somebody says some residents have topics imposed on them. Unfortunately, this makes it difficult for residents.
That's true.
I agree.
That's very true.
Please, can you hear me?
Yes, we can hear you now. Please go ahead and speak.
Okay. I just want to suggest that I know in my unit we have guidelines, suggestions on like timelines roughly, taking into consideration the process. I mean, when they should get the topic chosen and all that. I think it would be good to come up with some guidelines, because even the times that they have to submit to the college, the ethical approval and all that, the time for data collection, I think that it would be good for department. I don't know whether it can come from the college level. It's not a guideline, but just to guide the trainees, that maybe within the first month you should have come up with this, the next 2 or 3 months, I mean, proposals should be at this stage. You should submit to the college by this time, because they have 2 years roughly minimum to complete this. And I think that, I mean, some guidelines will be helpful at departmental level or at the unit level. And maybe it can come from the college, or every department should come up with something.
Yes, Professor Suman, we are actually looking at that at the academic board right now. There's a timeline, a proposed timeline, and academic board will soon be done with that, and that would be shared. There was actually a timeline there's actually a timeline in the guidelines for dissertation, but that doesn't spell out every single detail, and we've revised that, and we think we've improved it. So once academic board, sorts that document out, it will be out, so that people would know at what point they are expected to present the zero draft of the proposal. We haven't gone down to have your research question by this time, but it's like, for instance, if they come in January, we are saying that by March, which is 3 months, the zero draft should go to the supervisors. So then the department then can break out between the January and the March. And if, like we're saying, if we take January, February to kind of like sort out the research question, once that is sorted out, they can write within a month. That's probably the big hurdle that's out there. All right, Dr. Lawson, Henry, your hand is up. Please go ahead and speak.
Yeah, thank you, Richard. I wanted to add a little bit more onto this, assigning supervisors to the residents as early as possible in their training. I think in addition to that, we should also look at the issue of mentorship, where we have the formal mentorship and the informal mentorship. And so, some of us have seen the godfather role play in other people's lives, yet when we become fellows, it's difficult for us to do the same godfather thing that maybe we wish that when we're resident, we would have had that senior person that we could go to all the time. So I want to encourage trainers that on their own, informally, they should begin to mentor residents and do it voluntarily. Then also the training centers, it's the responsibility of the training center head, whether through the head of department or through the training coordinator, to assign mentors. Now, this practice should be different from assigning supervisors, because the supervisors may have to be related to the area where the candidate is doing the research. The second thing I would like to mention is that some faculties have challenges in the number of fellows or trainers that they have vis-a-vis the number of residents that they have to supervise. And so faculties that have come to the college to seek advice, we have said that we should try and get every resident to have at most 2 supervisors. And then if for some reason you don't have the requisite number of supervisors in your faculty, you could actually link with other faculties, look depending on the topic that the person is working on. So in family medicine, for example, we've linked several times with internal medicine. We have linked up with public health. I have a resident who did a work on sexual dysfunction in patients with cervical cancer in primary care, yet she had a gynecologist and I supervising. So these are some of the ways we can reduce the load, because sometimes residents tend to gravitate towards the trainer that they feel, as for this trainer, when we go, he's receptive and he will respond or she will respond and all that. And then sometimes within the department, 2 or 3 people will carry the load of a lot of trainers. And so I think that we should try and diffuse the load. And if the trainers are few, let's use this option of working with another, at least one of the supervisors must be from the candidate's faculty, but the others, so the faculties that are growing and they have fewer fellows at the top, some of these things can be used to help the residents get to target. And I think that the general rule is that by the end of the first year, your proposal, you should have finished proposal assessment by the college and collected your ethical approval. That would be a very good target for every resident to have right from the beginning. That by the time January the following year comes, the proposal should have gone to the college, you've done the corrections, you've gone back and forth and everything, you've received your letter saying that you should go for ethical approval. Then the final year is for data collection and writing up the proposal. Over.
Okay. Right, thanks, Henry. So we are going to provide a guide for that timeline, and that should be coming out very, very, very soon. There's a statement that Dr. Pedu-Mensah made that there may be a difference between the one who supervises the specific topic and the one who introduces a resident to research in general. What I'll say is that that's true. We need to make use of our strengths in the departments that we are and within the faculty. I mean, we might be able to identify amongst ourselves, either in our departments or in our faculty, that there are generally some people whose strength is the whole thing about research methodology. So those people can be given the responsibility within the department or faculty, or it could be a joint in the whole training institution, because research is generic. If in a training institution, we identify some 2-3 people who we think have a good grasp of the research methodology thing, they could be the ones who do the introduction of the residents to research. There are things that we plan to do centrally at the college administration, but I'm talking now at the training institution level. You may pick those people and they will do a general introduction of the residents to research and the steps that they need to take. So these people then serve as people that residents can fall on for technical support just in methodologic or analytic questions. Whereas there might be somebody else who is looking mainly at the content. I mean, what you are saying, does it match the current science, the medical practice? And that person might not really go into whether your sample size, your method of recruiting people is right. The person might not even have a clue about that. I mean, one of the challenges in our setting is that because we don't have, let's say, many people in the different disciplines, we kind of like act as if all this should be in one person, but really it shouldn't. I mean, there was some work I did with some American colleague some time ago, and she was telling me that all she does is come up with a question, and then on her team there's the epidemiologist who's the methodologist who will now say that if this is the question, then this is the study design that we must have, and then it's calculating the number of people must be recruited. So that's the teamwork thing. with a student, with the residents, we want the residents to kind of like know a bit of all of this. But then in guiding them, we might pick these experts to kind of like answer those questions. So I think it's the same thing that Richard is asking here, whether residents can discuss their research questions with all fellows at their respective departments, a series of meetings. Yes, definitely. I think, say for instance, in a place like Kolebu, I don't see why we can't have a forum where the residents come and then present their research questions or seminars, and people from different departments can have an input. I mean, the training unit can put that together. Because when it comes to general research methodology, I mean, Sandra as a dentist can sit in a seminar that has people from Ops and Gynae presenting and basically tell them what's wrong with their methodology. She might not know whether placenta previa is at the top of the uterus or at the bottom. She's probably forgotten all that, but she knows when you say that this is how you recruit women with placenta previa, she'll tell you that no, that's a biased way of recruiting the people. So I think there is that kind of cross-departmental thing, that interfaculty thing that we should develop at training institutions at the general college level.
Okay, wait, can I make a comment, please?
Sure, go ahead.
Yeah, sure. I think what you say is apt. However, I think on the ground, usually it works out differently. And it's also because of how the trainers get involved. Some of us are involved from day one, but it's not everybody. And you know, there's some delay, especially because of the non-involvement of the trainers as to one, the proposal that is approved, and two, the unleashing or the carrying out of the project. You know, so yeah, so all of us must be involved. But you are doing well, and indeed, you know, the trainers, you know, those who are minded, are making sure that what the college is interested in is done. So thank you so much. Yeah.
Is that Joel? Oh, it's who was speaking? Was it Conrad?
No, Dr. York.
That's Dr. York, yeah. So essentially what Dr. York is saying is that we should all be involved from day one. He's also trying to be gentle. Everybody should be involved from day one. And don't come in on day 54 and say that all that has been done from day 1 to 53 is wrong. Go start again. That is rather frustrating and depressing on the residents. I think. Please go ahead. Yeah.
Good evening, Rector and everyone. I have two proposals. I'll start by saying that these residents who are entering fellowship training, they are all adults, very big adults. I'm sure most of them are beyond, all of them are beyond 30 years. They know what is right, what is good.
Not all, some.
Some, majority of them. But I suggest that when they are coming for their interview for residency training, that senior residency, they present something, synopsis of their dissertation as part of the interview. You know, the interview, the way we do it now, we try to leave some emphasis on academic and what they know, what they don't know, within the time. So we can reduce some of those things. Let them present synopsis of their work, what they think they can do when they enter the senior residency program. Number one. Number two, when they enter after half a year, let's call them the college level again. Let them present their actual proposal at the college level, not the training level. Training level, you know, today I'm not ready. Today I also see somebody's, yesterday I also listened to somebody's work, but I didn't get because the person said you're not ready. If at the college level, the person will have to be ready to present a proposal. So that will be within half a year of their training. We can do them in batches. So that this time the writer will be there, like today we are there now, other officers are there, and it should be like a tough thing so that they can be tasked to present something. All those who are lagging behind now, they are those who haven't got any idea what to present. I can say that in Confirmation, one candidate That's I think a rector must give this person an award. He was the only one who presented his work, his dissertation proposal within 1 year. I asked him, so he had been thinking about it when he was, before he even came to the institution for his fellowship. He was thinking about it. But others today, let's talk, oh, I'm not ready yet. If you make it at the institution, sorry, if you make it at the college level, they'll be serious. One, let me summarize. One, at the interview, they should give synopsis what they want to do. Number two, half a year, June, July, thereabout, let them present their work at the college level. We can arrange that and let it be like a sort of examination. Let them present their proposal at this time. Thank you very much.
Okay, Prabhunoku, I think I hear what you're saying. I guess essentially what you're saying is that with the second point, that there should be an accountability mechanism. And that point is taken. We'll look into it and see what the accountability mechanism is. But I think we mustn't necessarily concentrate the accountability mechanism at the college administration. I mean, there should be some level of accountability that's happening at the supervisor level, some level of accountability that's happening at the departmental level, some that's at the institutional level, and also some at the college administration level. And we should work out what should be done at all these levels. Because if we shift everything to the central administration level, I don't think it will help the residents. The second thing about saying that they come with a synopsis at the interview, I would say that's the traditional British way of doing things, which the British have even moved away from. But generally, we who they colonized try to preserve their traditions better than they themselves. The Americans say you can't present something that you've not been taught to do. You have to be taught and then you are assessed. The British say, the old British, they say that once you are brilliant enough to come in for this thing or the PhD, I mean, you can figure out how to put a proposal together. It's like riding a bike. I mean, but it's not like riding a bike. I mean, that, and I'll say this very strongly, that we need to give the residents some guidance in terms of, and the college is thinking of what we can do centrally, in terms of having to tell them what they need to produce, point them to the material that they need to read, and then they turn out something. And we assess that, we assess what they produce. So I wouldn't vote for a lot being put at the interview level. I mean, they are now coming in to get some training, and then they can produce that. So with the timelines that we have and the things that we want to do about research, I think we'll be able to provide them that support and they move to this stage. And we are providing these resources now for the supervisors so that something can be done at the supervisor level. And then I'll say at the institutions, we can identify the people who are research experts, like Dr. Pidu-Mensah pointed out, who can do something for the residents at the institution level. And at the college level, we would also identify people like we're doing now, who will do things at the central level, and the residents will all get it. There are many things we've been talking about, and we will do that. So yeah, Christina has put that down, that the people need help. They appear not, they seem not eager because, I mean, to behave or something. It's because they need help, and they are often clueless. Christina, I agree with you. They're often clueless. So they need guidance, mentoring, and pressure, using clear timelines and genuine interest. Because, I mean, they'll come in, they'll do all the nodding, like, oh, yeah, probably they are adults. All of we adults know how to nod when people are talking about aerodynamics, and all we know is how to do a cesarean section, like myself. And then they're talking aerodynamics, and I'm nodding and looking very intelligent, and it's like I'm getting everything just because I don't want to ask a question. And they say, go and move a plane, and I can't do anything about it. So they know how to act like they've got it, but then they don't do it. And general clubs will be one helpful thing. Yeah, Connor said to make them become truthful.
Right, okay. Permit me to raise an issue again.
Is there different issues? There are some other hands are problem. So please let's get the other people and I'll probably
the same issue. On the same issue, I want to explain myself better. I was trying to say that while they've done all that the trainers have done, let them bring them to the college level at a point, maybe half a year, can maybe 1 year, so that we listen to them at the college level, so that we know that because look, we're calling these children of ours. Come present your work. They never, but if the college calls them, they will come. They'll go to our, they'll read online, something like that. Let's try that once, because I think we're all fed up by this lateness of candidates coming with their proposals. We're not talking dissertation at all, we're talking proposal. So let's try something additionally. All that is fine, but let's try additionally. Yeah. Bring them to book. Today, you, Mensa, you need to present your proposal at this time to the college level, and your supervisors will be there and be part of the present, those who listen to you. If you feed this for them, there will be a way of getting through somehow. I'm not saying this to solve the problem all the time, but let's try some of these things and see.
No problem. I agree with you, and that's why I'm saying that we'll set up accountability mechanisms at every level, including the college level. So I think we are agreed on that. Prof. Anson, please let's hear your comments. And
right,
Vera, is that an old hand or is it a new hand?
This is a new hand.
Okay, so after Prof. Anson, then Adubia would go, then Dominic.
Right, thank you very much.
Please go ahead.
Right, so I think we have all agreed that the residents are not coming out with their fellowship is because of some weaknesses at the supervisorship level. And that is why we're doing this strengthening and capacity building so that we are able to supervise the candidates. Now, I think that post this meeting or during this training program, we should have the checklist for the supervisors that would also be monitored somewhere during the accountability trail system, so that we'll know that even if this presentation that Prof. Abunoko is proposing that is done at the college level, we should have a check system at the departmental level, at the unit level, from the college to say, has this candidate presented his proposal? If not, then the one who is coordinating the fellowship at the departmental level should be able to respond to the college why that hasn't been done. Because you would have so many people who, if the college would have to handle the presentation at the last level, I don't think you can handle it, but we can handle this at the department level. And that checklist that is being monitored remotely at the college level would be able to make sure that all the faculties are on top of the game and the candidates are being supervised appropriately. Over.
Yeah, thanks, Prof. Anson. Like I said, academic board is looking at the timelines, but just so that we get something going, there are some contentious parts of that timeline that we can we'll pull out. I think it's fine to pull that out and share this draft timeline with this group, that this group can begin to work with something like that whilst academic board finishes off and gets the final timeline out. I think that would get pressure on us also to make sure that we finish things from the academic board level. Yes, Adubia, please go ahead, and then Dominic.
I just want to say that I think the time that residents were expected to present their topics was when they were doing the diploma in project design and management, which was supposed to fill the membership and the fellowship. So it is, I mean, it was expected that if they had done 1 year in that program, then they should be able to come up with a topic which they can present at the interview for their fellowship. So if that opportunity is still there, then I mean, I think that they should be able to present topics. I know we are modifying it to cater for senior residents and all that, but if we're still going to have that going on, then I think that they can still present topics, I mean, at the interview.
Okay, so we'll generally say that if it's to present what your topic is at the interview, I guess great, they can do that. But this is your topic. But if that's topic, but if it's like a proposal thing, I mean, I would say no. And the truth is that if we really want to do a critiquing of a person's research topic or proposal, we want to do that at the interview is going to take forever. Because when people do like a research seminar where they present their research questions and people ask them about it for them to modify it, the time frame is much longer than what we do at an interview. Sandra, would you agree with that? Yeah, it's much longer than what you do at the interview. And there are some other things that we look for at the interview. So I agree that this thing should be presented. And I think we all agree about that. It's just a question of where it is done. And the other challenge about approving a research topic at the interview is that you approve a topic, then send the person to a training institution where there is no subject expert in that on that topic. Then it becomes tough for the person to survive because the subject expert is not there. This sounded a really great thing when the person wasn't put in the context of an institution. So I think let's leave this discussion here. We'll talk about it further and come out with what is best. Okay, so this has been a great contribution, and I like the level of engagement. Bye for now.